All right, well, it is 11:30, so we will go ahead and get started. Good morning, everybody, and welcome back to Security Health Plan Academy. With us today is Nance. She is the RN Clinical Coordinator at the Institute for Quality, Innovation, and Patient Safety at Marshfield Clinic Health System. Nance has over 39 years of nursing experience and has been a certified diabetes care and education specialist for over 30 years. She is taught at the university and technical college level, but says her passion lies in diabetes prevention, care, and management. So without further ado, I will turn it over to Nance. Welcome, and thank you for presenting at our September Security Health Plan Academy.
Well, thank you, Ashley, for that wonderful introduction. So today we are going to be talking about diabetes care and management, and really what can you do? What can you do to prevent diabetes, to manage your diabetes, and to prevent the complications of diabetes? So welcome, everyone. Thank you for spending time with us today. We're going to have some technical difficulties right away here. Okay. It's not wanting to
move forward.
It's not wanting to go forward. There we go.
Oh, there we are. Okay.
Hopefully we have it going now. All right, so we know that diabetes is a serious disease. And according to the Centers for Disease Control and Prevention, a lot of Americans have that. Over 28 million Americans know that they have diabetes. The problem is there's another 8.5 million Americans that don't even know they have it. So if they don't know they have it, they can't treat it and they can't prevent the complications. There's another staggering number, and that is that 96 million Americans have prediabetes. And these are the folks that if they don't know they have it, if they don't do something about it, they will go on to develop diabetes. So as you can see, we're reaching huge numbers of Americans that have diabetes or at risk for diabetes. When we talk about diabetes, we know that it's serious. We know a lot of people have it, but we want to send a positive message because we can prevent the complications and we can prevent diabetes through proper management and care. And that's what we're going to be talking about today. Well, let's start by talking about what diabetes is. Now, if you think of your body as a car needs fuel, needs gasoline. Your body needs fuel as well. So when we eat when we eat food, it changes into sugar or glucose. And that's really our fuel, our gasoline. It gets into the stomach, and from there it goes to the bloodstream. Now, once that sugar enters the bloodstream, it signals the pancreas to make insulin. And that's important because that insulin is the key that lets that sugar into the cells to be used for fuel. And once it's in the cells, it's either used right away for fuel or we store it. But we want to get the excess out of the bloodstream so that it prevents the complications. Now, if you have diabetes, your body either doesn't make enough insulin, and so it can't be, or the insulin cannot be used as well. And again, if that insulin's not being used to open the cells to let the sugar come in, that sugar builds up, causes complications. Well, the first type of diabetes we're going to talk about is type 1 diabetes. And it's an autoimmune disease. And the body sees those cells in the pancreas that produce insulin as foreign, and it destroys them. Unfortunately, this type of diabetes can't be prevented, and they have to take insulin. So I like this picture because it really shows the graphics of what's going on. So if you'll notice in the top left-hand corner is your stomach. When we eat the food, most of it gets changed into sugar. It gets into the bloodstream, and that's represented by those little white sugar cubes. As soon as that sugar gets into the bloodstream, it signals the pancreas to make insulin, and that's symbolized by those little blue circles. From there, we need to have that insulin sit on the cell and let the sugar come in, which is what happens in that picture that's listed normal condition. When you have type 1 diabetes, and that's listed below, you'll see that there's no insulin to sit on the cell, so the sugar can't get in. And again, this is why those folks need to take insulin. They're not making any insulin. Now, how do you know if you have type 1 diabetes? Well, typically these folks get sick pretty quick. They find out they're needing to drink frequently. They're needing to pee or urinate frequently. They start getting very tired, and there's a sudden weight loss. Now, if you look at the pictures, there's a young girl who was diagnosed with diabetes, and this was in the early 1920s, right after insulin was developed. She's one of the first people that was treated with insulin. She was treated, and 4 months later, you can see how healthy she looks. Thankfully, she came at an age where the diabetes was developed. Before that, people died from type 1 diabetes. It's that serious. Now, type 2 diabetes, that's a little bit different. That's what the majority of people that have diabetes have is type 2 diabetes. About 95% of folks that have diabetes have type 2. And in type 2 diabetes, the insulin isn't used correctly. That's called insulin resistance. Now, the treatment for that might be insulin. You still have type 2 diabetes, but you're treating it with insulin. You might take pills. You might take shots that are not insulin. And some people can even manage it with their nutrition and their exercise. So let's take a look and see what this looks like. On the left-hand side of the slide, you'll see what's again supposed to happen in the cell. The insulin sits on the cell, opens a door, lets the sugar come in, where it can either be stored or used right away for fuel. It's getting that extra out of the bloodstream, so it's decreasing the complications. What happens in type 2 diabetes with that insulin resistance is the insulin, that little blue ball, sits on the cell and doesn't let as much sugar come in as it should. And the symptoms can be similar to folks with type 1 diabetes. Certainly, if they're drinking a lot, they're needing to urinate or pee frequently. Their vision can get blurry. They can be very tired. They might have numbness, tingling, or burning, especially in the feet. They could have skin infections. And the really tragic thing is some folks don't have any symptoms at all. So if they don't have the symptoms, they can't treat it. What are the risk factors for type 2 diabetes? Well, if you've had prediabetes or have prediabetes, if you're overweight, over 45, have relatives, parent, brother, siblings, sister that have diabetes, you're physically active less than 3 times a week, you've had gestational diabetes, or you've had a big baby over 9 pounds, you're African American, Hispanic, Latino, American Indian, Alaskan Native, Pacific Islander, Asian American, and if you have a non-alcoholic fatty liver disease. So how do you know if you're at risk for diabetes? Well, we're going to share this risk test in the email that's going to be sent to you after the presentation. It's going to ask you several questions. How old are you? Are you a man or woman? Have you ever had gestational diabetes? Do you have a mother, father, sister, or brother with diabetes? Do you have high blood pressure? Are you physically active, and are you overweight? If you score 5 or more, you might be at risk for developing type 2 diabetes. Well, how do we know if we have diabetes or prediabetes? This chart gives us the different types of tests and how a diagnosis is made. So let's start with the first one, which is a fasting blood glucose test or blood sugar test. That's the one where they don't let you eat for 8 hours before the test. If you have prediabetes, the reading would be 100 to 125. And if you have diabetes, it would be 126 or above. And they need to do this test 2 times for you to get the diagnosis of diabetes. They could also do something that's called an oral glucose tolerance test. You go in and you get a fasting blood sugar. They give you this really sweet, sugary solution to drink, and they have you come back in 2 hours and test your blood sugar again to see what it is. If you have prediabetes, the test would read 140 to 199. And if you have diabetes, it would be 200 or greater. Again, we need 2 of those tests. Now, if you just come in and have what's called a random blood sugar test, well, you're not feeling good, you have symptoms of diabetes, and they test your blood sugar any time of day. If it's 200 above and you have the symptoms of diabetes, then it's considered to be diagnostic of diabetes. There's another test we can do called an A1C test or hemoglobin A1C. And that measures what your blood sugars have been over the last 2 to 3 months. So if it measures 5.7 to 6.4, that's considered prediabetes. And if it's 6.5 or above, then you have diabetes. Well, let's go back to this big issue of how can I prevent type 2 diabetes? You take the risk test, you find out you're at risk for diabetes, or you have prediabetes. There's a wonderful program called the National Diabetes Prevention Program. And of course, I'm a little bit partial to that because I'm one of the facilitators for that. It's a proven program. A lot of research has been done on that. And the great news is if you go through this program, it's a year-long program, and you complete the program successfully, means you stay in the program, you lose 4 to 5% of your body weight, and you get 150 minutes of active exercise at a moderate level each week. The statistics really show that you can decrease your risk of developing type 2 diabetes. 58% decrease unless you're over 60, and then it's a 71% decrease in developing type 2 diabetes. It's a great program. So if you're interested, you can send an email to this West Prediabetes at Marshfield Clinic, and that also will be sent to you after the program. Well, what if you already have diabetes? How can you manage it so you don't get the complications? We're going to talk about diabetes self-management education, nutrition, monitoring, activity, medications, blood pressure, weight, and diabetes-related tests that will help you manage your diabetes. Well, we have to start with the first one, which I'm again prejudiced to because I did it for decades, diabetes self-management education. It's really important that we go to that because it can help you manage your diabetes. The average is it's able to decrease your hemoglobin A1C by 1%. Now that's an average, but I've seen many people decrease it significantly more. And you have to remember that some people's hemoglobin A1C is very close to normal when they come in, and others is very high. The educators are going to give you information to help you take control of your diabetes. They're not going to tell you what to do and make you do it. They're going to work with you. They're going to find out what it is that you need. How old are you? What's your food budget? What are you interested in learning? What's your daily life like? What do you do for a living? Are you retired? What matters to you? And they're going to tailor that program for you. It's important to come in when you have a new diagnosis, if there's changes in medication, nutrition, or exercise, or you want to improve your diabetes control. Another big thing that these educators can do is they can work with your provider and adjust your medication. And that's really important to take control of your diabetes. So you do need to ask your provider for a referral for diabetes education. And we do offer it in many of the sites. Otherwise, we offer it via telehealth. So of course, one of the people that we want to see for the diabetes self-management education is our registered dietitian nutritionist. And I think sometimes people do not want to see the dietitian because they don't want to talk about their food. They don't want to be told what to eat. And that's really not, okay, I had a little pop-up coming on my screen, sorry about that. They really want to individualize it for you. I would have patients come in and they say, well, you're going to tell me what I have to eat. No, that usually doesn't work. I'm going to talk to you. I'm going to listen to you. I'm going to come up with a plan for you. And then you're going to tell me if that works for you or if it's something you can do. Because if it doesn't work for you, you're not going to do it. So they'll, again, individualize a plan for you based on your likes and dislikes. If you don't like green beans, they're not going to tell you to eat green beans. They'll talk to you about the medication because depending upon what you're on, that really determines what your food timing looks like and the quantity of food and the types of food. Are you active? How old are you? And how much money do you have to spend on food? And this needs a referral from the provider. Well, if you have diabetes, again, we want you to see the dietitian so you get a diet that's tailored to you. If you have prediabetes or risk for developing diabetes, we're going to start simpler. We're just going to do the basics, which are eat less and eat right. And this general recommendation comes from myplate.gov. You can also go on the nutrition.gov sites and find more information about this plan. So you start with a 9-inch plate. We're not going to use that big turkey platter for Christmas and Thanksgiving, but we're going to use a 9-inch plate. And 1/4 of it can be whole grains or starchy carbohydrates or beans. 1/4 of it is non-starchy vegetables. 1/4 is lean protein. 1/4 is fruits. And you can have a dairy on the side. Again, this is very basics, but it looks at proper nutrition and amounts. The next thing we want to talk about is exercise, that dreaded E word that people don't like to do. Well, let's change the E word to activity. Move more. And you can move more anytime, anywhere, anyhow. So the idea is just begin by moving. Now, if you haven't done anything, you're not active, don't start by doing 30 minutes today or tomorrow. It's going to be too much for you. You're not going to like it. You're going to be sore and you're going to give up. So whatever you're doing, start at a few minutes if you're not active and see how you feel the next day. You want to start slow and easy. You want to feel like, oh, this was pretty easy. I could do this harder. I could do it longer. And you want to build from there. So if you're only doing a minute a day and you add a minute each day, by the end of the month, you have 30 minutes each day. It's quite a bit of activity. So start slow, go easy, set realistic goals for yourself. As you become more active and you take medications for your diabetes, those might need to be adjusted. You want to talk to your provider about when you should call them with your blood glucose readings, which is a great segue into our next topic, which is blood glucose monitoring. You want to have a conversation about blood glucose monitoring with your provider. Is it something that I should do? How should I do it? What should the numbers be? When do I test? And how do I test? Can I use a machine like is on the screen, a finger stick? Or would I qualify for something called a continuous blood glucose monitor? That's inserted on the body and it stays for 7 to 10 days. It gives you readings of your blood sugar constantly. You'll need to check with your provider to see if you qualify for that based on your diagnosis and the medication, and of course your insurance. So medications, again, you could be taking pills for your diabetes, and it could be several different types of pills because we have different categories of pills that work different ways. So one works on one thing, one works on another. So you might be taking a couple different types of medications. You could be taking a medication that you inject that is not insulin, or you could be taking insulin. And as you can see, there's many different types of insulin. And when you take your insulin, if you look at the picture, it could be a syringe. So you draw the insulin up out of the vial. It could be an insulin pen, which is in the middle of that picture, or it could be an insulin pump. Well, what else can I do to stay healthy? We mentioned that 5 to 10% of your body weight makes a big difference in preventing diabetes and managing your diabetes. Also, we want to make sure your blood pressure is under control. Should you be monitoring at home? And if a provider wants you to monitor it at home, which device? Because some devices are better than others. They're more reliable, they're more accurate. And certainly you want them to check it in the office. And is it something that you could come in more frequently and just have them check your blood pressure? And there's annual tests that will help you determine how your diabetes is being managed and if there are other things that need to be done. So that hemoglobin A1C we talked about, that measures your blood glucose readings, averaging those over the last 2 to 3 months. Might be annual, but you might need to take that every 3 months. Depends upon where you're at and the type of diabetes you have. That dilated eye exam where they put the eye drops in and your eyes get big and dilated, you wear the funny sunglasses afterwards. That should be done once a year. The kidneys can be tested either with blood tests and urine tests. And certainly the cholesterol, at least annually, might need to be more frequently than that, depending upon what it is and what medications you're on. So this was a very brief presentation about everything you wanted to know about diabetes, but we only had 30 minutes to discuss it. So what questions or feedback or comments do you have for me?
Perfect. Thank you so much, Nan. I did have two questions. The first one was, what diet is the best one so that we can avoid getting diabetes?
Sure, and that would be the one that I mentioned, that plate method. We're going to start very simple with that. And if you go to nutrition.gov and myplate.gov, I believe, are the websites, they'll give you more. And you can even do a plan that's individualized for you. So if you go there, you can give them the information about how old you are, male or female, and it'll ask you several questions, and it'll come up with a plan for you. I'd also ask that you talk with your provider about what works for you. And again, can you see a registered dietitian?
Great. A question here, does metformin work well for diabetes?
Oh, great question. So metformin has been around. I think I started doing diabetes education in 1990, and it had been in Europe for 20 to 30 years before that. So a long track record. Sometimes providers will start people on metformin if they have prediabetes. When we look at the treatments for diabetes, there's something called an algorithm, and the providers can look at that. It's a standard, comes out every year, about that tells the providers if a person is this age, and this is what their hemoglobin A1C is, and these are the other factors they have. Maybe they have kidney disease, liver disease, high blood pressure. It'll suggest a medication to use. And that's really what the providers will do, determining what medication for you. Metformin is one of the first ones that's listed, provided you don't have some other issues that would contraindicate that. Thank you.
The next question we received, would it be beneficial to take super beets to alleviate neuropathy pain?
Well, that one I don't know anything about. If you have those specific questions about supplements, over-the-counter medications, I'd ask that you talk to your provider about that and or the nutritionist. We hear a lot of things about sleep aids, nutritional supplements, and those may not be regulated by the FDA, which means may not be consistent from company to company, or even within that company, of how much is in that supplement. So please talk with your doctor. You might be taking medication that would be contraindicated for a product or supplement.
Ooh, another good question was just submitted. How does drinking alcohol affect sugar levels?
Oh, that's another good one. Straight alcohol can lower your blood sugar. Now, we don't want you to go out and use that as a medication, but I tell my patients, if you're going to drink alcohol, you need to be eating at the same time if you're taking medication, and particularly insulin, because if it lowers it, certainly it lowers your blood. It can lower your blood sugar, but it can also lower your ability to think. So you might not recognize a low blood sugar. And I'll share the seriousness of this one. My stepson has type 1 diabetes. When he was in college, he did what college students do and had some alcoholic beverages. Unfortunately, he had hypoglycemia. He didn't recognize that and started seizing. It happened twice. That's not fun. He doesn't do that anymore, thankfully, but he could have died. So you have to be careful if you're drinking alcohol. There are other reasons that we want to watch how much alcohol someone is drinking or we're drinking because of its impact on the liver and the kidneys. The kidneys can be impacted by diabetes. Complications of kidneys can be actually kidney failure. So if you're going to consume alcohol, I'd have that conversation with your provider because they know you, they know your diabetes, they know your complications, they know how your other organs are functioning, and they can give a recommendation for can you and how much and what types. Good question. Thank you for asking that.
That's great. Well, I don't see anything else that's been submitted. So, we can probably wrap this up and give everybody a few more minutes back in their day. But if anyone that either is attending today or watches the presentation afterwards has a question, you are welcome to submit that, and we'll connect with Nanc and we'll do our best to answer.
Thank you
So,
so much for allowing me to present today.
yeah,
I'm very passionate about the diabetes. My mother had it. I lost an aunt and an uncle because of diabetes, and certainly my wonderful stepson has it. So I wish you the best of success in managing your diabetes and no complications.
well, thank you for joining.
Thank you.
Bye-bye.
Bye-bye.